Good evening and welcome to the Nevis Newscast. Today is Wednesday, November 30th, 2016. I'm Donis Wilkinson Keynes. Premier of Nevis, the Honorable Vance Amory, tabled a $236 million budget when he delivered the NIA's 2017 budget address during a sitting of the Nevis Island Assembly, which began at the Assembly Chambers at Hamilton House this morning. Premier Amory is Minister of Finance in the Nevis Island Administration.
The total expenditure budget for 2017 is set at $236.3 million. This represents an increase of 22.42% over the 2016 budget estimates, driven mainly by the capital investment budget. We have allocated the amount of $157.29 million to recurrent spending, representing 66.57% of the total projected budget expenditure.
The Minister of Finance noted that the NIA intends to be strict with the collection of taxes and expects every citizen to pay his fair share of taxes as the administration endeavors to provide the best service in education, health, and public utilities for all at a reasonable cost.
This administration is projecting to collect the amount of $140.26 million in recurrent revenue, with the amount of $105.12 million to be generated from tax revenue and non-tax revenue contributing the remaining $35.14 million. When compared to projected revenue expenditure of $157.23 million, this should provide a deficit of $16.97 million, which will be covered by the ongoing transfers from the federal government, being our fair share of revenues from the processing fees under the CBI program.
According to the Finance Minister, $79.01 million has been allocated to capital expansion.
This represents 33.44% of total projected expenditure, an increase of 120% when compared to the capital allocation of 2016. The major increase in the capital budget symbolizes the determination of this administration to undertake a number of capital investment projects, which are now ready for implementation as funding has already been identified.
The debate on the NIA's 2017 budget is set to commence at 10 a.m. tomorrow, Thursday, December 1st. A number of women in leadership positions and other female professionals from across St. Kitts and Nevis today participated in a forum on the Sustainable Development Goals (SDG) agenda. The Honorable Hazel Brandy Williams, Junior Minister of Social Development, conceptualized the idea for the forum.
This important gathering of vibrant entrepreneurs comes at a most opportune time where we seek to give greater recognition to the capacity of our women to become major actors in the development process. During your deliberations here today, your attention will be drawn to some of the very important themes surrounding the Sustainable Development Goals. It is my hope that after today's session, you will be more informed and enlightened about the Sustainable Development Goals and how you can help to make them a reality, whether through individual contribution or community action. It is also my prayer that the increased gender sensitization from this forum will bring about and will make all of us eager to do the job and to join the movement and partner with government and civil society organizations to promote the rights of women and girls.
The Ministry of Social Development collaborated with the United Nations Population Fund to host the forum. Siti Batul Hossein, Deputy Director of the UN Population Fund's Sub-Regional Office in Jamaica, made a presentation on the first 5 SDGs: no poverty, zero hunger, good health and well-being, quality education, and gender equality.
This event demonstrates the importance that St. Kitts and Nevis accords to the implementation of this new agenda for sustainable development for the well-being and resilience of its citizens, with focus on women and girls. We think that they will have to enjoy same opportunities, rights, and obligations in all spheres of lives. This means sharing equally in the distribution of power and influence, and having equal opportunity for financial independence, education, and realizing their personal ambitions. Thus, gender equality demands the empowerment of women with a focus on identifying and redressing power imbalances and giving women more autonomy to manage their own lives. When women are empowered, whole families and communities benefit, and these benefits often have a triple effect on future generations. UNFPA is excited to be partnering with the Home Minister, Ms. Hazel-Williams, and on this initiative, and looks forward to the outcome of this forum and to the development and implementation of strategic interventions to advance gender equality and women and girls empowerment in the Caribbean.
Telka Wallace presented on SDGs 10 and 16, reduced inequalities and peace, justice, and strong institutions. Wallace, along with Hossein, also facilitated a discussion on follow-up actions with implementation timelines and responsibilities. A number of healthcare professionals were on Monday, November 28th, trained in the use of the recently improved Perinatal Information System. Medical Officer of Health, Dr. Judy Nisbet, gave an overview of the workshop, which was held at Emergency Operations Center at Long Point.
The Perinatal Information System has been in use for the past 10 years. This, however, is an improved version that is more user-friendly, and it also reflects some of the priorities by ministries of health in the region. It collects a range of information throughout pregnancy, childbirth, and while the mother and the baby are hospitalized. Today we are training in the paper-based version of the perinatal information system. However, there's an electronic version which we were fortunate to be trained in about 2 weeks ago, and both versions will complement each other and ensure that we have proper data collection.
According to Dr. Nisbet, this improved version of the Perinatal Information System collects a lot more information.
For instance, we have a Zika form because we know that the Zika causes adverse pregnancy outcomes, and so we now collect data on Zika symptoms. So the objectives of the workshop would be to address the current data challenges such as consistency, accuracy, and standardization of data. It ensures more timely collection and analysis of data. It assists in the evaluation of our national and regional health programs and the quality of care that we provide. It assists in identifying high-risk pregnancies early, thus ensuring better maternal and neonatal outcomes. And it provides requisite data to inform the development of the family health policy and plan.
Strategies such as these, Dr. Nisbet noted, will ensure the gains made in maternal health over the years in St. Kitts and Nevis due to the hard work of dedicated healthcare professionals are sustained. Mary Keynes, a staff nurse at the JNF General Hospital in St. Kitts, was trained regionally in the Perinatal Information System. She facilitated Monday's training. Still to come,
on Friday, December 2nd, we'll have our National Testing Day from 9 to 3 p.m. at the Health Promotion Unit.
We'll give you the details after this break.
As a responsible taxpayer, you help to finance free health care at all health centers on Nevis. Thank you for putting country above self. This message was brought to you by the Inland Revenue Department, Nevis. Be a responsible citizen. Welcome back.
In a World AIDS Day special for Live It Up, the director of PAHO, the Pan American Health Organization, noted that the Caribbean is on track for validation as having eliminated mother-to-child transmission of HIV. PAHO's director is Dr. Carissa Etienne.
It's a big achievement, and certainly we hope by next year we will have the news that we have eliminated mother-to-child transmission in the Caribbean, and we want to do that for the rest of the region. Cuba has already done it, and we want to expand that to the rest of the region. The target for mother-to-child transmission of HIV, AIDS, and syphilis has also to be seen within the whole context of elimination and prevention of HIV infections themselves. No? Importantly, we say you need to treat all of your patients. So that means we must have the programs for diagnosing. We have to deal with stigma and discrimination. We have to ensure that the antiretroviral treatment is available for all persons who are infected.
Meantime, in his World AIDS Day message, Executive Director of UNAIDS, Michel Sidibé, thanks the region for the gains it has made in HIV prevention.
In Caribbean, you came together. You create space for solidarity. You help us to address this epidemic, to break the conspiracy of silence, to give knowledge to mothers. Almost every country in your region is capable to say today that they will be certified as a country free of babies born with HIV soon. And I want you to be also the first region to say to the world that you end this epidemic. And to do that, we have 5 years. 5 years window of opportunity. We need to fast track in these 5 years. And we need to quicken the pace. We need to make sure that each country in the Caribbean will be able to achieve 90-90-90, which means 90% of the people will be able to know their status, 90% of them will be put on treatment, and 90% of those people who are on treatment will suppress the viral load activities in their blood.
Meantime, Dr. Edward Green, UN Special Envoy on HIV to the Caribbean, says while World AIDS Day provides the ideal occasion to join scientists, activists, practitioners, and people living with AIDS in celebrating the successes achieved, it is a time to caution against complacency that will contribute to reversing these gains.
Prevention must therefore be a flagship for sexual and reproductive health and rights, age-appropriate sexual education, access to condoms and pre-exposure prophylactics. It must also be a standard bearer for reducing violence against women, girls, and adolescents, and eliminating AIDS-related stigma and discrimination. Let us raise our hands in support of prevention to signal justice for all. Let us raise our voices in global chorus for prevention, ending the AIDS epidemic.
Meantime, Nevis's Health Promotion Unit will be hosting a number of activities in observance of World AIDS Day. One of the activities is National Testing Day, which is scheduled to take place on Friday, December 2nd at the Health Promotion Unit on Juice Street in Charlestown. Program Coordinator in the HIV Unit, Nadine Carter-Keynes, is encouraging persons to get tested.
On Friday, December 2nd, we'll have our National Testing Day from 9 to 3 p.m. at the Health Promotion Unit. Again, the Health Promotion Unit is on Juice Street in the Phoenix building on the bottom level. So you just step in, a counselor will be there, you get your blood drawn, you get your result the same day.
Carter-Keynes says the rapid testing would be implemented in 2017.
Our rapid test is where you normally can just come in, get your finger prick, and get your results within 30 minutes to 45 minutes. We're doing that come next year in different locations.
World AIDS Day is celebrated annually on December 1st, and the theme for this year is Hands Up for HIV Prevention. The other activities for World AIDS Day include a Hands Up for HIV Prevention campaign and workplace information sessions scheduled for Thursday, December 1st. That's it for this evening's edition of the Nevis Newscast. On behalf of all of us here at the Department of Information, thank you for viewing. I'm Donis Wilkinson Keynes. Good night.